Pendulums, 3 sets of 10 circles in each direction. Lean over with the good arm supported on a table or chair while relaxing the surgical arm, letting it hang straight down. Let gravity do the work by moving it in circles. Letting the arm rest on a table, use the surgical arm to squeeze the stress ball for 2 minutes. Scapular retraction or pinches, 2 sets of 10. Clinicians should place their hand between the patient's shoulder blades. Instruct the patient to squeeze the clinician's hand using the shoulder blades. Hold each squeeze for 2 to 3 seconds. Active range of motion for cervical flexion and extension, 30-second holds for 1 set. Patients should bring the chin to their chest and then tilt the head back all the way. Active range of motion for cervical lateral flexion, 30-second holds for 1 set. Bring the right ear to the right shoulder, come back to neutral, bring the left ear to the left shoulder, and then come back to neutral, and repeat. Active range of motion for cervical rotation, 30-second holds for 1 set. Patients should rotate their head to the right, come back to neutral, and then rotate the head to the left and return to neutral. Repeat. Passive range of motion for shoulder flexion, 20 to 30-second holds 3 times. Clinician should stabilize at the patient's wrist and elbow, then passively turning the palm inwards towards the body. Clinician passively lifts the arm into flexion until end range of motion is reached without pain. Hold for 10 seconds. Passive range of motion for scapular external and internal rotation, 10-second holds 3 times. Patient's elbow should be at 90-90 near the body. Clinician should stabilize the patient's wrist and elbow to the body while moving the arm in external and internal rotation. Active assisted range of motion, shoulder flexion and extension with cane, 2 sets of 10. Using a cane, patients should grip one end of the cane with the right hand. The left hand will be used to guide the cane up to assist the motion of the surgical shoulder. Stationary biking for 5 minutes. Surgical arm should remain in sling. Remind patient to keep their hips planted in the seat of the bike while biking.